Hello guys. Okay, so I wanted to come in here and give you my 3 tips for a better morning huddle. So tip number 1, make sure you are meeting 10 minutes before your first scheduled patients. I like to give at least 10 minutes. You'll see why. There's some things that I think are very important to go through before your start of the day. So at least give yourself 10 minutes, 10, 15 minutes. This might mean, you guys might have to come in 30 minutes before the start of your patients, however long it takes you to get ready in the morning. But just make sure you're saving that space in the morning to review these really vital things that you need to review as a team before you start seeing patients and before the chaos begins of the day. So someone should be in charge, either the doctor, the office manager, of when you see that clock that it's 10 minutes before you're rounding everybody up, come to the back, come to your team meeting room, and start your morning huddle. Tip number 2, I would recommend that you have each team member present something during the morning huddle. So, it helps when it's not just one person that's in charge of going over everything. Sometimes, we don't mean to, but it's the morning, your eyes can glaze over, you can kind of stop paying attention. That's why I think it's so important to have everybody have something to say. It keeps you on guard, it keeps you alert, it keeps you ready to present. And when you're presenting too, I think it just makes everybody more accountable to a successful day in the practice. And then last but not least, tip number 3, have everybody fill out and use a morning huddle sheet. So I have examples of morning huddle sheets in my course, Elevate Your Front Office, but just so that I can give you some takeaway tips today, if you don't already use and fill out morning huddle sheets, everybody again will have their own morning huddle sheet. Some examples of things that you'd fill out and present in the morning huddle. For the treatment coordinator, who did not schedule their visit yesterday. So who had next treatment or who had a next appointment and who did not schedule and why. And then what is our follow-up going to be for that patient? The financial coordinator, you can discuss who has a balance that you need to see today. Maybe it's an overdue balance that you have to see them before their appointment. The appointment coordinator, they can bring the openings in the schedule over the next 2 days. They can then give downtime tasks or jobs to the clinical team. So if the hygienist is open for an hour, you can say, hey, Mary, can you call this list during your open time? So just really taking control of that schedule. The office manager can go over your production collection goals, your new patient goals, any special campaigns that you're going through that month, whether it be getting more Google reviews, having people go to your social media pages, whatever your focus is for the month. Then your hygienist. You want to talk about who has unscheduled treatment that's coming in that day, what family members are not scheduled for recare of those coming into your schedule today. You can talk about who's due for Veloscope, laser, fluoride, LAPT. You can tell the front office team members who needs an updated health history. And then also for accountability wise, I think it's great if you can just pick out those few people that you are going to ask for a referral today. So if you voice it out in the morning huddle, chances are it'll get done because you're telling everyone, hey, this is who I'm going to ask for a referral from today. And then last but not least, our assistants. You can talk about, are your lab cases back over the next 2 days? Who has next treatment? Do you have all your intraoral photos and x-rays for your crowns and those types of procedures? Who is coming in on your schedule that does not have a recare appointment scheduled? And then you can talk about any emergency or new patients that are coming in today. So I hope these 3 tips help. If you would like to get the full morning huddle sheet, go check out my course on Elevate Your Front Office. Not only do we go over morning huddle sheets and checklists, we go over every single system in the office, from collecting at time of service, reviewing treatment plans, case acceptance, insurances, everything to help your office run smoothly. So I hope this was a help, and I hope you guys have a great